COVID-19, or coronavirus disease 2019, is an infectious illness caused by the SARS-CoV-2 virus, a member of the large coronavirus family. SARS-CoV-2 primarily causes a respiratory illness and can infect both people and animals, with symptoms ranging from mild to severe. Common symptoms include fever, cough, fatigue, and loss of taste or smell, while more severe cases can involve shortness of breath, hypoxia, and pneumonia. It's important to note that some individuals infected with COVID-19 may not develop any noticeable symptoms at all. The pandemic's history began in December 2019, with the first cases of pneumonia of unknown origin reported in Wuhan, China. By January 2020, a novel coronavirus was identified as the cause, leading the World Health Organization to declare a public health emergency of international concern on January 30th, 2020. The virus was officially named SARS-CoV-2 and the disease COVID-19 on February 11, 2020, with the WHO declaring it a global pandemic on March 11, 2020. The public health emergency of international concern was eventually ended by the WHO on May 5, 2023, marking a significant shift in the global response. In the United States, the first confirmed case was reported on January 19, 2020, in Washington state. By March 26, 2020, the U.S. had the highest number of confirmed cases globally, and as of November 27, 2025, it still holds this unfortunate distinction. COVID-19 became the third leading cause of death in the U.S. in 2020, contributing to over 522,000 excess deaths from March through the end of that year. India reported its first COVID-19 case on January 30, 2020, in Kerala, and as of November 27, 2025, has the second highest number of confirmed cases worldwide. Lockdowns were implemented in Kerala on March 23, 2020, followed by a nationwide lockdown across the rest of India on March 25, 2020. A devastating second wave hit India in March 2021, leading to severe shortages of vaccines, hospital beds, and oxygen. During late April 2021, India led the world in both new and active COVID-19 cases, highlighting the immense scale of the crisis. SARS-CoV-2 spreads easily from person to person, primarily through respiratory droplets produced when an infected individual coughs, sneezes, speaks, sings, or breathes. Transmission occurs when these droplets come into contact with the eyes, nose, or mouth of another person, or indirectly through touching contaminated surfaces. Key prevention methods include staying up to date with COVID-19 vaccinations, which significantly lowers the risk of severe illness, hospitalization, and death. Wearing a mask is crucial, especially when experiencing symptoms or after exposure, as it helps protect others from potential transmission. Practicing good hygiene, such as frequent hand washing with soap and water or using hand sanitizer, is also vital in preventing the spread. Maintaining physical distance from others, known as social distancing, helps reduce the chances of transmission. Improving ventilation, particularly in indoor spaces, can further lower the risk of virus transmission. Finally, staying home and away from others when sick with respiratory symptoms is a critical precaution to prevent further spread. Treatment for COVID-19 is primarily symptomatic and supportive, focusing on alleviating discomfort and aiding recovery. Early treatment with antiviral medications can also play a significant role in reducing symptoms and lowering the risk of severe illness. Understanding COVID-19's definition, history, epidemiology, and prevention methods empowers us to protect ourselves and our communities. By staying informed and adhering to public health guidelines, we can continue to mitigate the impact of this global health challenge.